Well, hello and welcome to Streamlining Sjogrens. If you have made it to this course, you probably fall into one of two buckets. Either one, you are suspicious that you have Sjogren's, but you're having a hard time getting diagnosed. That's something that Sarah and I know a lot about. Or you fall in another bucket, which means you're probably newly diagnosed and you want to learn more about the systemic disease. Maybe you're even having a difficult time working with providers to get the treatments that you need. So this is a great foundational course to understanding Sjogren's and navigating your path to diagnosis and treatment. A little housekeeping before we dive in. We are not giving medical advice. This is for educational purposes only. We are hoping to give you tools and information that you need in order to better advocate for yourself, because we believe that patients should always maintain autonomy over their healthcare decisions. So welcome to the course. You're advocating for yourself already by enrolling in this course. And I'm just going to ask you right from the top if any of these sound familiar. You wait for months for an appointment only to have a few minutes with a provider for them to dismiss your concerns. You're denied referrals or treatments because your labs are normal. Maybe you can't even get the right labs ordered, or you're told that it's just anxiety or stress, or you need to lose weight. If any of those sound familiar, we want you to know that you are not alone. We have been where you are. I got sick in 2019 after a virus. I started to get pins and needles and burning and patchy numbness in my hands and my feet. I had crushing fatigue. My GI system seemed to stop overnight. And eventually I would get dry eyes, or my eyes would seal shut overnight, as you're seeing in this photo. And I would have excessive thirst. And it would be a gut punch when I would get those normal tests back. Usually we would be excited to have normal test results, but when you're so sick and you don't know what's wrong and you get those normal labs back, it doesn't feel great, especially when providers are dismissing you. So I really advocated for myself. I learned to advocate for myself. Hi, by the way, I'm Kristina. I'm a board certified patient advocate and owner of Little Engine Patient Advocacy. I do have a background in healthcare, but despite that, it felt very different to be on the other side of the exam table. It took me about 5 years to get diagnosed, dozens of specialists, and I had to put so much effort into educating myself and learning about Sjogren so that I could get the diagnosis, I could get the right tests. And one of the many resources that I found the most helpful, the top of the list, was Sjogren's Advocate, and that is run by Dr. Sarah. So I cannot begin to describe how honored I am that she has joined forces with me on this course. She's going to bring her wealth of knowledge, both as a patient and a provider, but I'm going to let Dr. Sarah say a few words about herself and Sjogren's Advocate and her journey. So Dr. Sarah?
Hi, everyone. I'm so pleased to be here and so amazed that Kristina is doing this work, and very excited to be working with her. So yay. My story, I'm just going to do a very brief synopsis of how I started doing advocacy work. And I'm a Sjogren's patient and have had signs and symptoms of Sjogren's since my teens, but wasn't confirmed until age 52. So despite being an MD, like many people who are listening here, I had my symptoms dismissed, especially when I had negative test results, which is a really common experience in Sjogren's. So I had been kind of brewing along, feeling worse and worse over the years, managing to work full time and having two school-age boys, when at age 44, I took a sudden downturn after a medical procedure and spiraled into basically what was catastrophic illness. I could not even stand without feeling like I was going to faint. I was mostly bedridden, couldn't fully take care of myself. I felt so sick, it was hard to describe. And I had extreme abdominal pain. And at first, my doctors were concerned and started ordering tests, although it would be months between each set of tests. And they'd say, well, it's not that, it's not that. And I'm like, I'm losing my career. I can't drive my kids to school. I can't even eat anything normal. I was just awful. And eventually, after a year of workup, all my tests were normal, and my doctors kind of gave up looking. And most of them started going back to, well, you probably have fibromyalgia, irritable bowel syndrome, or stress. And I think they thought because I had a very rapid heart rate, which turned out to be POTS, POTS, which is a very common and devastating problem caused by Sjogren's, that they assumed it was anxiety. So I had an MD, but it was still psychologized and subject to the same biases that many women face when they have a complex disease that their doctors don't understand. So, desperate for help and feeling abandoned, I just dove into the medical literature and read and read and read and found out that, oh, this really fits a clinical picture of Sjogren's. And it took a lot of work to get diagnosed as even possible Sjogren's at that point, because I didn't have any of the antibodies. My lip biopsy wasn't positive. All the details of my story and how I finally got diagnosed are on my website. But I swore to myself at that point, if I ever get well enough to function, I'm going to help other patients. So that's what I do. This was 23 years ago. I'm 67 right now. And I've been living with this for decades, and treatment does help a lot. I'm not well enough to work as a physician, but I am well enough to use what energy I have to help patients. And so I want to be able to use my knowledge and skills to help you use the same information I had to advocate for yourself. But the one thing that's frustrated me through this whole process is, I have the clout to be able to present scientific information to my clinicians. And sometimes they're not receptive, but mostly they are. And patients who don't have a medical degree often have more trouble doing that. And when I started reading Kristina's work, her website, her book, I was thrilled, because she fills in the gap that I just feel is so important, because you can have all the journal articles in the world and follow my instructions for self-advocacy, and it won't work because they think, well, you're just a patient. So I love her work, and I can't tell you how happy I am to be here working together.
Oh, well, thank you so much. It is a great partnership, and I hope that we do many more collaborations together. So keep that in the back of your mind, student, that maybe there's more good stuff to come. This is a direct quote from one of my first rheumatology experiences. Sarah, I'm sure you have a few good ones too. Quit seeking specialists and move on with your life. This is what I was told when I had a positive ANA, but I was negative for the traditional Sjogren's antibodies, and I was so sick, and I just couldn't get anyone to take me seriously. And I think when we start to feel hopeless and we're sick and we're being dismissed, I'll take some ownership that I had some cringy moments. I made some mistakes, like misusing the patient portal or staying with bad providers too long. And these are the lessons that I learned along the way in order to be a better patient and learn how to advocate for myself. And that's how I treat my healthcare now. I treat it like a company, and I try to be the boss. So here are the things that Sarah and I would like you to walk away with when you finish this course. By the end of this program, we hope that you are a Sjogren's expert without having to spend countless hours reading, researching, watching random YouTube videos, because there's a lot of misinformation out there about Sjogren's. So sometimes you're spending all of those energy or those spoons on even the wrong information. So we want you to confidently understand Sjogren's labs and tests that go beyond an ANA. And if you're not even sure what an ANA is yet, don't worry, we're going to talk about that. We want you to know how to prep like a pro so that you can minimize appointment anxiety, and how to handle medical gaslighting, which too many of us have experienced. We also want you to become an expert in keeping your medical records squeaky clean and accurate. And we're going to talk about why that's important. And we're going to unravel Sjogren's at a deeper level so that no provider can pull a fast one on you ever again, like saying, oh, Sjogren's is just a dry eye and dry mouth sicca syndrome. You'll know better. I'm sure you do already. And you're also going to walk away with invaluable checklists and scripts and templates so that you have easy plug and play tactics. And last but certainly not least, because it is good medicine all on its own, we want you to feel validated and to know that you are not alone in your healthcare journey. So a little information about how this course works. If you're watching this introduction module right now, then you're already ahead of the game. You are in your course platform, you saw the video and you're playing the video, and that is one of the pieces that you'll get throughout the course. You'll have video instruction, which what you're watching right now. You'll also get a PDF of just the slides for you to save to your computer or print out and always have. And then you will have those downloadable resources that I mentioned, those trackers and scripts and forms that you will have as additional resources. This should look familiar. Here's a screenshot of your course platform. So on the right-hand side is where you can view the slides or the video like you are right now. And then along the left, you will see the modules in order. We do suggest that you watch them in order as they sort of build on themselves. And you can also see at those little icons on the left, you can see if something is a video by the little play button, or if it looks like a little piece of paper, those are just your PDF slides or your downloadable resources. Some tips for success. This is a little personal, but I like to open up the PowerPoint slide and the downloadable resources and either print them or save them into my computer and then watch the video instructions so that I have the resources in front of me. You certainly don't have to do it that way, but just a little personal tip. And, I do want to remind you that it is okay to learn at your own pace. Information can be really overwhelming. So please move at a pace that feels safe and helpful for you. Sarah, did you have anything to add to that?
Yes, I think the pacing part cannot be overemphasized. I'm on Smart Patients, which is a really great support group, and some of the new patients who are either seeking diagnosis or have just been diagnosed are totally overwhelmed. And that group is great for helping you get a grip on it's like triage. You have to prioritize what you need to learn at first. If you're seeking diagnosis, you just need to learn about how to get diagnosed, or if you're newly diagnosed, which specialists and which things about your disease do you need to prioritize? And it varies by person, but I have over 100 pages on my website, and people sometimes just get lost in it and overwhelmed. So like I said, I'm on Smart Patients every day. I help people by showing them, well, this page will help that particular problem. And you just cannot learn it all, because I think the thing that stuns people early in their course of illness, or not necessarily how sick they might have been sick for a long time, but when they're finally getting into the medical care part or diagnosis part, to find out how many clinicians know very little about Sjogren's, and that even the specialists, the rheumatologists who are supposed to specialize in rheumatology diseases, often don't know some of the fundamental facts of the disease, and they too sometimes spread misconceptions about the disease. And that's what my website, a lot of it focuses on, is like, how do you deal with it when your rheumatologist tells you, for example, that if you don't have SSA, which is neither Kristina nor I carries that autoantibody. And that makes it harder to get diagnosed. And it also makes it harder to get taken seriously, because we can have a little bit of a different profile of manifestations, but it's still a serious systemic problem. And yet there's this myth out there that it's not. So anyways, I don't want to get too sidetracked into details. We'll cover all that later, but it's important to know that we do have help out there. And I have step-by-step information on my website. And then Kristina has the how-to. What do you do with the unreceptive clinician? What do you do with the dismissive clinician? What do you do with the clinician who accuses you of using Dr. Google when you bring them information that is either from the Sjogren's Foundation or from the medical literature? There are different ways to deal with that. And I just can't say how excited I am that Kristina is just a star at working on this stuff and showing you how to navigate that. And sometimes you just have to leave and find a new provider, and that can be frustrating. But I think the thing is people get seriously ill and they think, oh, well, the doctors will know about it, especially if it's a common disease. Doctors will know how to treat it. There's great treatments available, and I just have to get diagnosed and then it's all, they'll fix it. None of those things is true for Sjogren. So you actually do need to learn a lot, and we're really here to support you with that.
Very well said. Yes. We all wish it was that easy, but no, you made very good points. And hopefully this course will help with that. So what are you getting in this course? You're going to get lifetime access to all 6 of the teaching modules. Again, you're going to get those downloadable resources that come with each of the modules, and a very safe place for you to learn and accelerate your care. If you have questions throughout the course about the course itself, you can reach out to me. You can email me at Kristina@littleenginepatientadvocacy.com. If you're having technical issues, you probably don't want me as your IT person. You're better off reaching the course platform, which is Podia. And if you're in the course, there's a question mark icon at the bottom right. You can click that to chat live during their hours, or you can email them at hello@podia.com. Before we wrap up, Sarah, is there anything else that you wanted to let folks know?
Yeah, I forgot to add this in earlier. Kristina talked at the very beginning how we're not medical advice. A lot of people don't understand what that means exactly. So I have on my website, Sjogren's Advocate, I have an email there. People can ask me questions about content or make comments on content, or even tell me, oh, there's a typo on this page, which I appreciate. It's just a huge website, but please don't write me with your individual stories, your lab work. How do I get, convince my doctor this or that? Use the website for the information, but then if you want to chat about it, you want to have big community feedback and interaction, go to Smart Patients. I'm on there every day and I give a lot of valuable information there, but in there, I'm not acting as a physician, I'm acting as a fellow patient, and I have to divide those roles up. By the way, I'm not a practicing clinician. I deactivated my license, and I just do not want to be involved in any way in providing medical advice. I have to give information so you can work with your own doctors. So I just want to make that really, really clear, because a lot of people get confused and they say, well, I thought you were a doctor and I wanted to ask you what my lab means. It's like, no, I can't do that. But if you want my opinion as a patient, I will probably answer it on Smart Patients. And a lot of very, very smart people are on Smart Patients, and the name fits. So I encourage you to join that. And you just Google Smart Patients Sjogren's and you'll find the group.
So some optional homework assignments for you to check out Smart Patients, and then also sign up for Sarah's newsletter at Sjogren's Advocate, which is always so helpful. Of course, optional, we don't want to overload you with information, but those are 2 great resources to check out. And when you are ready, you can head over to module number 1. We'll see you there.